With every finger prick you see here, it's one finger prick closer to a record of 1,000 here at the University of Manitoba today. Very important cause, joined by John and Darren to talk a little bit about why we're here, why we're doing this. First of all, John is a senior instructor here at the University of Manitoba in the geography department, and you are someone who's received blood. So this is a really close cause to your heart. Tell us your story.
About 14 years ago, I have a pre-existing condition. So about 14 years ago, I started to lose blood internally, and I needed to get a blood transfusion. So I had 2 units done over a couple of days. So that kind of basically helped me get through it and probably saved my life.
So what was the idea behind creating an event like this, as far as testing blood types and getting 1,000 people finger pricked and all of that? What was the idea behind it?
The first idea is to get people to know what their blood type is, which is important not just for an event like this, but for everyday life. And the other thing is to recruit people to give blood. It's important, as I can testify to that.
All right, well, Darren is with Canadian Blood Services. So tell us a little bit about the blood type testing here and exactly what is happening.
Sure. Basically, the blood typing station here, what happens is people will come in, we ask if you'd be interested in getting a blood type, and then you sit down and you get just a finger poke. And after we gently poke your finger, what happens is we take a few little droplets of blood, we mix it with some serum, and based on the blood clotting, we can tell you what blood type you are, so A, B, O, or AB.
So what is the most common blood type, and what is the blood type that is most needed?
Right. The most common blood type in Canada is actually O positive, and one of the most unique blood types is O negative because they're the universal donor and they can give to everyone. So.
And then what is the most rare blood type?
The most rare, per se, would be probably your AB group, but overall the O negative is the most important because they're the universal donor and can give to everyone. So
very important to know your own blood type, obviously. Should an emergency situation happen, really good to have that information.
Absolutely. So we all have our own blood type. So for example, myself, I'm O positive. So if I were to need a procedure done, when I go into the hospital, they would make sure that I am properly matched so there would be no reactions when I'm going through the procedure.
So obviously this is also not just about finding out blood type, but encouraging donors, and at the university a great place to get people started when you're young, get thinking about it, get into the habit. Just talk a little bit about blood donating and where the need is at these days.
Sure. I mean, there's always a need and a constant need for blood. So, just to give you an example, over the next 2 weeks we have over 2,500 appointments available for blood donors to come down, and right now we have about 1,000 of those filled. So we're really looking to urge people to make appointments and come down and donate blood.
And I guess, obviously there's people who will be long-time donors and then come into a situation where they can't give blood anymore, so you're always needing to update that list and get more people regularly donating, right? I mean, it's really critical to keep, that's why the push is always on.
That's right, and that's why we're here today. It's really it's a fun and interactive way to give awareness about blood donation. It's to get new students and returning students excited about donating blood, and it's really here to show that there is that constant need and that we do need people to come out and support our cause.
And for those who are a bit squeamish, how much does the blood, the finger prick hurt?
Actually, I'll be quite honest with you, the finger prick doesn't hurt that much, but it actually hurts less than the insertion of a needle for a blood donation. So we actually do find that once people get their finger poke and blood type, that they transition into blood donors quite easily. All
right, so if somebody wanted to make an appointment, which hopefully there's folks out there saying, hey, I haven't given in a while, I need to get out there, what do they have to do?
Sure, they can call our 1-888 number, so it's 1-888-2DONATE, or they can even visit our website at blood.ca to learn more information.
All right, Darren, thank you so much for your time. John, thank you so much for organizing this event here today, and good luck getting to 1,000.
We will, definitely.
Thanks so much.
Thanks.